Family struggles with healthcare are commonplace in the US, where healthcare is a highly fragmented, largely for-profit system. However, in most high-income developed countries, there exist universal healthcare systems, which differ slightly but with the common goal of guaranteeing healthcare as a right for everyone. Two such countries are the United Kingdom and our neighbors to the north, Canada. Canadians take immense pride in their solidarity through the Canadian healthcare system. Through federalization of cost sharing, the Canada Health Act of 1984, Canada's Medicare, expanded coverage universally, a system based on need rather than ability to pay. Thomas Clement Douglas created the prototype for the Canadian health system in the province of Saskatchewan in 1947. As the Social Democratic premier of that province, he recognized the need for a public health care system stemming from a childhood sickness that almost cost him a limb due to his family's inability to afford health care. Saskatchewan's healthcare system was publicly funded and went on to cover both hospital care and primary care. The Canadian system is not a national health service like the UK's. It simply funds healthcare through public taxation with the decentralization of hospitals and doctors. This means that Canadians can choose to go to any private hospital or doctor, which are free at the point of care. In other words, coverage is portable. You choose your doctor and the Canadian government foots the bill. Provinces and territories must abide by the Canada Health Act in order to receive federal funding. Three main areas are stipulated in the Act: portability, universality, and accessibility. Portability, to allow for Canadians to receive free health care anywhere in the country. Universality, meaning medical needs are not based on one's ability to buy a service, but based on need. Accessibility means that no one is charged for publicly funded services, so no payments or deductibles when a Canadian sees a doctor or has to go to the hospital. Canadian healthcare costs are 10.4% of the GDP compared to the US GDP at 17%. Life expectancy and health spans in Canada are both 10 years more than in the US. The US population experiences higher premature death than Canadians, deaths that could have been prevented with adequate healthcare. Canadians have less cost barriers to healthcare than in the US. What these indices are pointing to is that Canada spends less on healthcare with better outcomes. A criticism of the Canadian system is the long wait time for non-emergent elective care like hip surgery or medical imaging. However, Canada's longer wait times for elective care aren't correlated with increased mortality. While the Canadian government cost shares, it does not operate or deliver healthcare systematically. Therefore, doctors aren't incentivized or organized to decrease wait times. It is important to note that Canadians always receive immediate emergency medical attention when needed. Great Britain and its countries of England, Scotland, Wales, and Northern Ireland make up the United Kingdom. The UK's universal healthcare system is known as the National Health Services. The UK system cost shares and delivers healthcare through government-issued hospitals and doctors. The UK system is funded by public taxation, and the country spends 9.7% of its GDP on healthcare, beating both the US and Canada in terms of cost efficiency. Before World War II, the UK healthcare system depended on voluntary funding from charitable organizations and corporations and private fees. Like Canada, Britain saw a need to establish a healthcare system in the name of public good. Healthcare is viewed as a right, and society collectively is responsible for the health of the nation. Post-World War II, the National Health Services was born. Citizens can either utilize the services of the NHS or acquire private healthcare. UK government coverage accounts for 85% of healthcare spending, while 15% goes to private coverage. Public taxes fund healthcare services providing high-quality integrated healthcare. The federal regulations for funding and physicians reduce common disparities, all while saving excessive healthcare spending. A A collection of surveys by Commonwealth revealed that the UK ranks first in efficiency in terms of healthcare cost saving, with high scores for quality care and access. The UK NHS manages to cover 58 million people, virtually 100% of its population. The US covers about 83 million people, a mere 30% of its population, pointing to the massive US healthcare coverage gap. Canada and the UK and their respective universal healthcare systems point to a cultural view of healthcare that is fundamentally different from the US. The rugged individualism that is an American virtue does not have to apply to the way we conduct our healthcare system. We can honor individuals by collectively appreciating their right to healthcare. This right to healthcare is not born of entitlement, but rather an inherently human need that transcends all cultures.